Hello everyone, it's May the 26th. I'm Dr. Adam London, Director of the Kent County Health Department, here for today's COVID-19 update. Across the state of Michigan, it's reported there are 54,881 cases. That's an increase of 201 over the previous day, and 5,240 deaths statewide, an increase of 12. Here in Kent County, we have 3,385 cases of diagnosed COVID-19. That's an increase of 26 over the previous day's number, and 68 deaths, an increase of 1 over that previous day. And we're also happy to report 1,653 recoveries as of today. So we've learned an awful lot about COVID-19 over the course of the past couple of months, and that's a reassuring thing because we didn't know a whole lot about it 2 months ago. But we have applied sound scientific principles to how we're responding to COVID-19, and thankfully we've learned a lot and we're applying those lessons as well. For instance, we've heard a lot of people say that they were sick in January, February, March, and many people swear that that illness must have been COVID-19, and because of that they must have antibodies and are immune to it. There are a few studies, and while it's possible that someone could have been sick with COVID-19 in this area without having been diagnosed in January or February, as early as that, it is pretty unlikely, however. There have been a couple of studies, and I mentioned the one a few weeks ago from Mount Sinai, in which they tested over 600 people in New York that were sick with COVID-like symptoms during March and April to see how many of them had the antibodies to respond to COVID-19. And only about 37% of them did. So a majority in New York City, which was really ground zero for so much of this epidemic in the US, only 37% of the people who were sick that were untested actually had antibodies. There's a new study now that was published in the Journal of the American Medical Association looking at over 800 people in Los Angeles County. It's a random sample of adults in Los Angeles County to see how many of them have antibodies to COVID-19. And only a little over 4% actually had those antibodies. So more compelling information that says that the large majority, really the overwhelming majority of us, probably have not been infected and don't have any protection thus far to COVID-19. So please don't think that if you were sick earlier on this year and you weren't tested, but you were sick, please don't think that that was COVID-19. It probably was something else. We've also learned that inhalation matters most when it comes to becoming infected with COVID-19. Early on we didn't know if it was hand to mouth, if it was surfaces, if it was inhalation, probably all of the above. And it probably still is somewhat all of the above, and so I want to encourage you to keep up the hand washing and the disinfection of surfaces. But we're learning more and more that the inhalation of viral particles, and those are particles that are exhaled from those who are infected or in their cough, their sneeze, their breath, that inhaling those viral particles is what puts you at highest risk of infection. So wearing masks and maintaining the social distancing is very important for keeping the inhalation down. Another thing that we're noticing is that the viral load exposure that a person receives correlates to severity of symptoms. So for instance, if I were exposed to someone who, been walking down the street, exposed to someone coughing, I'm probably less likely to develop severe symptoms as a result of that infection than I would be if I were living in a congregate group setting with lots of sick people all coughing. So the viral load is very important in making sure that we don't overwhelm the immune system, which again points to masks and social distancing as important tools for keeping that viral load exposure as low as possible. We're learning that screening of symptoms, testing, and then isolation and quarantine strategies are also very effective. So we've done 3 runs of sampling now at our shelters in Grand Rapids for those people who are experiencing homelessness. The first time, we found that 27% of those residents were positive for COVID-19. Now, the sick individuals were isolated from the rest of the population and allowed to recover elsewhere. We then went back a couple of months later and we tested the other people again at the shelters, people who were previously negative or who were new residents at the shelter, and we found that only 7% were positive for COVID-19 at that time. We then isolated that group so they could recover outside of that group setting. Well, last week we went back and we tested the residents again, at that shelter, the people who had previously been negative and all of the new residents, and we found that only about 3% this time were positive for COVID-19. So we're seeing that screening for symptoms, testing, and isolating the people who are positive does have an impact on reducing the overall prevalence of infection in a setting like that. And we want to continue to use those lessons to protect everyone in the community. So wearing masks, maintaining the social distancing, screening for symptoms, testing on a periodic basis, and isolation and quarantine are all evidence-based right now for doing the very best we can to reduce the spread of this in the community. I'm Dr. Adam London with the Kent County Health Department, encouraging you, stay positive, stay heroic, and stay healthy. Thank you, and I'll talk to you again tomorrow.